Today, we're excited to have a very special guest, Dr. Ina Jurkevich, Executive Director of the American International Health Alliance. Dr. Jurkevich has dedicated her career to medicine, leadership, and improving health around the world. Today, we'll be talking about her career, journey, global health, the work of AIHA, and her advice for young people interested in making a difference in healthcare. Can you please introduce yourself?
Sure. Hi, Ada. My name is Ina Jurkevich. I'm Executive Director, as you said, of American International Health Alliance, AIHA. It's an American nonprofit organization that works globally.
What inspired you to pursue a career in medicine and international health?
Well, since my early childhood, I always wanted to help people, and it came naturally to go to medical school. But then I decided that global health is really area that gives me um, more satisfaction, I would say, in what I do, and it's really my calling. So I changed my career path, and I'm very happy that I did.
Can you tell us about your journey to becoming the executive director of the American International Health Alliance?
Yes, so I started my job with uh, I mean, it's not a job, but I started working with AHA actually, even when I lived in Russia. I lived in Moscow, Russia, and we participated in one of AHA projects. And I saw this project is so wonderful. It was partnership with maternity home, as they called, for in one of the biggest hospitals in Russia. And to me, to see how this partnership transform the services, open up new services like partnership in birth, for example, which wasn't allowed before. How many things have changed just because of this exchange? So I thought that this is a wonderful organization, and I wanted to do something like that. So when I moved to United States, that was organization where I applied. And so I've been with the organization for 25 years. So when I moved here, I started basically from entry position, almost entry position. And I worked in different capacity in different countries. And to become the executive director, of course, it's a long way for me. I've been with HA for 25 years, and now I'm really glad that I've been in leadership position before as a director of programs, and now as executive director. But it took a lot of hard work and also dedication and loyalty for organization. But yeah, but it was a long journey, 25 years.
Was there a specific experience that made you realize you wanted to work in global health?
Yes. So I worked in as an internist in outpatient clinic. I also had some night duties, but especially working in outpatient clinic, I realized it's not really my dream job, and I was not even sure 100% what else I want to do. And then I applied for a position with United Nations High Commissioner for Refugees to be a medical coordinator in one of the refugee camps outside of Moscow. So when I went, so after a couple of successful interviews, I went there to the camp. And when I heard from refugees and asylum seekers and from medical personnel how unorganized all this is, I thought, like, I see clearly what needs to be done. I was so excited about this opportunity because a lot of children, for example, from Afghanistan's rural areas, they were not even vaccinated. There were so many problems. And, being young and very enthusiastic, I thought I see clearly what needs to be done. And at that day, I thought like I wanted this job like nothing else, in terms of jobs in my life. And I used to work also for International Federation of Red Cross, and all these jobs were humanitarian in humanitarian field. But I made decision then, and I thought that that's absolutely what I want to do, and this is my calling.
What does the American International Health Alliance do, and what is its main mission?
So that's international NGO. We only work globally. So our vision is a world with equal access to care for everyone, everywhere. And so the mission is to strengthen workforce and health systems in different countries via partnerships that are locally driven and sustainable. So that's our mission. And we worked over the years in more than 40 countries. And AHA was established in 92 by actually initiative of State Department after collapse of Soviet Union. So the idea was to create this organization that main model that we use is just work the partnership, institution to institution partnership based on respect, mutual respect, accountability from both sides, and collaboration. That was really interesting idea, and I was lucky to be part of it on the other side. So that's what we do, and we work in over the years, I would say, in main areas of global health. Since 2000s, we work on HIV, but in other areas, of course. But HIV was one of the main program we worked on in many countries, and I have experience working and managing projects and leading projects in 27 countries. So we work globally, and we've done so much, and we don't have time to talk in details about everything.
How do you manage to work in all 27 countries, globally?
So they're not at the same time. The largest one, the largest number of countries at the same time when I was program director was 15. You don't work alone, right? You rely on your team. So, and each country has a team, has a country director, and we had a very, very strong team in HQ in Washington. So, whatever you do as any leader, without your team, you're nothing. So that's why we have a team at AHA and also our partners that we work on the other side in the country we're working with. And these teams are really inspiring, but I should tell that it was a very demanding job.
How does AIHA work with the healthcare professionals and organizations in different countries?
So we have three different models how we work. So number one, the first one, and this is how we started these partnerships that I described briefly before, institution to institution. We use this model, for example, right now, we work in the Philippines, we work with Philippine General Hospital, which is largest hospital and one of the most I would say recognized hospitals in the country. And we work in many aspects in HIV, emergency preparedness, infection control, prevention and control, etc., just to name a few. So for a program like that, we usually look for a partner from the other side, from the countries, usually developed countries. So I don't like this developed and undeveloped. It's like very black and white. But I would say we call them resource and recipient partners. So the resource partner, in this case, is New York City Health and Hospital Network. So it's a network of all public hospitals in New York. So in that way, when we solve all this, not to solve, but trying to solve different issues, when we work with hospital, so they listen to each other. It's a very collaborative exchange. It's professionals at the same level talking to each other, and change happens much faster If our scope of work, let's say, is the assessment of some particular hospital and write a report with recommendations, for that we will use some consultancy firm, or just one person, depending on the task and its complexity. So the third model that we implement, when we implement the project ourselves, it's also in the Philippines. It's called direct service delivery. So, and we work with community-based organizations, and we have our team of technical team that actually works on implementation. So sometimes the members of AIHA team are technical, and they actually technical experts, and they are running the program from technical side. But because of our model, we would like to give opportunity to the hospital, university, or community organization to work with the similar ones from the other countries. So that's why we use these three different models working in different countries.
Why is international collaboration so important when it comes to improving healthcare?
Uh, so in the world of globalization, the borders can't stop infection diseases, let's say, to spread, or outbreaks, as we all know with Ebola. Ebola and COVID. But so that's the only way, I think, to operate these days. Um, so the benefits are people can learn from each other. There are so many things already developed by anyone. So the health professionals, especially in resource limited countries, don't need to think that they're on their own in this. So the community of people who work together on global health is so big, and there are so many resources there. So that's saving time and resources. You learn from the best experience. Some medicine or test system should be and could be provided via international collaboration. And also in some ways, especially for when we deal with special pathogen management as Ebola and other very serious outbreaks. So we need to have a joint database for surveillance to understand and to help the country sometimes with limited resources to address and to contain epidemics. So there is no other way these days.
What is one American International Health Alliance project or accomplishment that you are especially proud of?
Mm. I would say it's dreams. So we had this project in Kenya near Lake Victoria. So the entire project was funded by a US government and Gates Foundation and pharmaceutical agencies. So it was, firms. It was really collaborative effort, and a lot of very bright people thought about design. And it was implemented at 10 countries, and we were lucky to have this program in Kenya. So the program is, so DREAMS stands for determined, okay, I won't go into this, but it's just for girls from 10 years old and young women, so from 10 to 24 years old. So the goal is to limit HIV infection among these girls and gives them better opportunities in life, like finishing school, for example. So we worked, of course, only with girls from impoverished families and with very limited resources. So in Kenya, of course, things have changed and keep changing. But at that time when we worked, so after, I believe, 4 years in school, it was a fee of $50 per student in school. And in some families, that was too much to pay, $50 per year to pay for school. So girls either didn't finish or just finished like a few years, went for a few years. So we helped, we paid for school, we provided uniforms, and we had this sophisticated approach of different interventions. So some of them were behavioral some of them structural interventions. So, like working with the family and strengthening family connection and understanding how, helping them to understand that this girl has a future. There are some cultural norms that when we work globally, it's very, you can just come and change them, right? Because you think yours are right and theirs are not. It should be all based on respect, and change comes very slowly. So that was community education, community engagement, etc. So there were some interventions for these girls, for example, the social asset building. So each girl had to open a bank account, for example. We taught them how to save money, just a little bit, $1 at a time, which, and saving for some people, they believe that they can't save until they, get something big going on. And for these girls, big may never come. So we help them to learn about the social skills. I'll just give you an example, maybe because I know I talk in such a broad and kind of about such a broad framework. But for example, when I was there, I was really touched by this girl. She was 9 years old. And when they talk about the social assets building and saving, she said, like, okay, who would like to share the experience? She said, I saved about $20 because I can walk instead of taking the bus, and I don't buy candy, and I have enough airtime. I think I'll talk a little less, but I'm saving. And the mentor said, okay, what are you saving for? She said, I need a little bit more, and then I'll buy a goat. It's like, goat. She's like, yes, it will be my own goat. And I know a family with a goat boy. So then my goat will have babies, and then I'll have my business. It was so touching for me to hear the example as such. And once these girls, starting from, no, she was 10 probably, because the start was 10 years old, very young. She looked like younger than that, and she already has these ideas. So this program, each girl, we worked separately with each girl. It was not this massive, kind of trainings for 2,000 girls. Each single girl had different interventions, and we worked with 33. So I'm very proud of that, that we helped 33 girls from very poor communities to finish school and to learn these very important skills that make them stronger and safer.
What has been one of the most rewarding experiences in your career?
The most rewarding is when programs that we implement together and design together, whatever we do, we always work with partners, from the countries we're working with. We don't come with solutions. But when these programs are sustainable and when our funding ends and the expertise and skills and programs that benefit patients are still there, and that's very rewarding. And as a second, I would say for me, when we work we work with community members, with universities, with hospitals, but there is always, whenever you work, there's some people who care about what we do more than the others. So I love seeing them grow from community organizations. Some people didn't even finish high school, but what they do, they could be like champions. They're so proud, and number of people tested, and number of people enrolled in prevention to prep or something else. So I love seeing my team grow and using opportunities these partnerships provide. And I have a lot of wonderful examples from different level from US and other countries. So that gives me a lot of joy, should I say.
What has been one of the biggest challenges you faced, and what did you learn from it?
So I work in HIV basically from the beginning of 2000. So in many, many countries. So whenever we work, I think the biggest challenge, and I would say the biggest challenge probably that could be so easily fixed, not easily, but should not be there at all, a stigma towards people with different diseases, more usually infection diseases. So it's as a TB or tuberculosis or HIV. So I've seen myself and spoke with a person, not naming country, who said that he would rather die than let his family know that he's HIV positive. And he was so young. And it just breaks my heart to know that people just afraid um, of this stigma and judgment by community much more than they're afraid to die. And sometimes they change their minds, and sometimes it's too late. And so that's the challenge that exists in all countries, with HIV, and things are changing. But, I believe you asked also, so what I learned from it. So what I learned from it is to never give up. I never think, never judge also on my side, those people who have stigma, but try to understand why. So we do surveys. We shouldn't assume that they're doing it because of ABC. We didn't even ask them why. We should ask, we should understand what the stigma is based on, and then try to educate community and with very targeted approaches, because addressing exactly what causes the stigma. But it's easier to say than to do. But we definitely work in this space because, especially when the project is funded only for 1 year, it's sometimes not do everything at once to implement the program and do survey and then analyze and act upon. But we're doing our best. But my observation from all these years, it's actually this year, 30 years in international development, is that people are good. Overall, people are good. People don't want anyone to die because they judge them. They don't even realize probably that, but we shouldn't assume anything and should actually understand the cause and work on it and try to explain to them that HIV these days, it's in such a different disease as it was 20 years ago, not even talking about longer.
How has being a physician influenced the way you approach leadership?
Um, Being physician, it's very people-centered. So whatever we do, I think it's like empathy because you care and you work with people, um, work for better good. So that was very helpful for me because when I work on global health, it's really technical knowledge is really helpful. And honestly, in some, especially when it's new project and we're just introduced to a country team, being a physician gives more credibility. But overall, it's just I think you already have some skills and this empathy and the the you're trying your best to help not only your patients but also your team, because without that nothing's going to happen.
What qualities do you think makes someone a great leader in healthcare?
So in healthcare, the great leader uh, in healthcare, again, the empathy, just knowing whatever this clinic is doing, the core is helping, right? Improving services, providing best services you can do so you can deliver. So I think it's very important for a leader to really be passionate about this and to be true to the cause. So that then to have a vision and to understand also the systems that are in place in the healthcare that this leader is operating, and be open enough for constructive feedback and being ready to constantly evolve. So that sounds easy, but it's not. So to really be flexible, to be constructive, to have a vision, and very, very important to empower your team, to care about your team, because the leader with the best vision in the world, if team is not there and team doesn't believe in him or in her or in the cause, it's not going to work. So it's a combination of all this, I believe.
How do you stay motivated when working on difficult or complex healthcare issues?
I, what we do is, I know it sounds very very broad, but we do save lives. And when we implement some program, let's say in the Philippines again, this community-based program will save thousands of lives, helping people to understand. And HIV epidemic is very young in the Philippines. More than 50% are younger than 24. And so, of course, as part of, when you're so young, people think they're invincible, everything's fine, there's no symptoms. So, and then we help them to get on treatment, we help them to prevent the disease. And that's so important when we see this people, who are on treatment right now, and they wouldn't be without us. And speaking about big, I would say undertaking, like helping big hospital to improve infection control and prevention strategies that will benefit thousands of people who are in this overcrowded hospital. For me, the impact of this work, it's so important. It's even if sometimes we see so much misery and poverty and all that, but what we do together, that's it's changing people's lives. And of course, what we do is not like you go there and you think you're saving the world. There are there are a lot of time spent on budget development, proposal writing, reports, etc. So it's not as glamorous as sometimes people think, but the saving lives and changing the health systems for better, that's an enormous motivation for me and my team.
What advice would you give to students who are interested in medicine or global health?
I'm not sure I'll say something new for that. So of course, I would say that the performance at school is very important, of course, and being ready to learn all life, like keep learning. In medicine, there is no other way, maybe in any specialty, but in medicine in particular, because it changes so quickly. So I would say there is a huge, like on my experience, there is such a big difference to be a doctor and work in global health. Because I would recommend students, high school students who are considering that, to do as much as you can to sign up for different courses. There's so many, like first aid and there's so many different I even experience in practicing something that you learn, it's very important. And then very important to interact with different people, not just people you think are cool and fun to talk to, but just try to talk to anybody and just see, because interpersonal skills are so important. Doctor won't talk only for those he likes or she likes, right? So you need to learn also for people to open up and to see if you enjoy it or it's just one stress. There's so many components in being a doctor, that you never know, of course. It's difficult to decide in high school, but the more practical experience students have, the better. Also, US is so diverse. I would highly recommend someone who wants to be a doctor or he wants to work in global health. Try to also work with communities other than, communities that your family belong to different nationalities and see how that goes. Because when you go to a country sometimes and nobody speaks English, or it's just you do everything with translator, it's difficult. So you need to see, for some people it's so stressful. They can do it. So all this practical experience and to see how people center you are. And then for me, is to distinguish between being a doctor and focusing kind of on one person. I think patience also is very, very important because, let's say as an internist, I had every day, most of my patients, I had maybe 60%, 70% had, complaints of hypertension. So they will come in every day, will complain about this. So you need to be so focused and open and patient. And, that's a real calling. So I really encourage people to practice as much as they want, as they can, not as they want, and to see if they enjoy it or not. And global health is not just you go and global health may not involve much travel also. It's a research, it's a data, work with data, work from, analytical reports. It's not necessarily just going and saving people in different villages. It's, or cities. That's very different and very diverse uh, discipline.
What skills should young people start developing now if they want to make an impact in healthcare?
What skills?
Yeah, like do young people need if they want to make an impact in healthcare?
So I would say there are a lot of skills, but it's also depend on the position and on in healthcare. Also, there is so much work, like also in public health, for example, that will require different skills. But overarching skills are interpersonal communication is very, very important. Being flexible and being kind of have a mind of problem solving because there are so many people who also focused on the process and some people more focused on impact on the outcome. So it's very important to have kind of both, not just it doesn't matter how we do it, as soon as it's done, it's not going to work in healthcare. But at the same time, people also need to have, as we say, proven record to themselves to understand that they can actually solve problems. They can help their friends to, in some kind of fight or disagreement to find common sense and common kind of solution. And academic achievements, of course, it's very important to have like analytical mind. And it's also very important to speak well. I found this a little underestimated because there are some leaders that are so such a good public speakers and charismatic and can ignite their team. And some people could have the brightest ideas, but it's another story, let's say.
Do you think students need to know exactly what career they want to pursue at a young age?
I don't think it's that's all necessary to know exactly, and people also shouldn't be afraid to change course later. But all those examples that I provided before, I think should help to at least understand what you don't like, because some. Young students. We also have volunteers for different initiatives, and some people will come and they're like surprised, what they need to do, and how complicated it is sometimes even convince someone on a big event not to do certain things. It's complicated. So the more experience they have, understanding I like talking to different people. I like to talk with people who are older or younger, and they listen to me, and I listen to them. As this active listening, for example, it's just so important. But getting back to your question is, I think it's very important to know what you don't want to do. It's very important from my perspective to understand why you want to ask yourself, why do you want to be a doctor? Do you think it sounds glamorous and people respect you? But it's a very demanding job. So what exactly attracts me in that? So you ask yourself, and also I think it's very important for people to try to choose something to do that they're good at, that they, learning fast in that particular, area they would like to explore, that truly interests them. And they're already showing something, to their friends and family. For example, if someone wants to be a doctor, but never ever sign up for any classes or doesn't even know how to do simple, first aid, finishing high school, that maybe it's not their calling. It's not like it's going to come later. It's a process. So I would say explore everything around the area you're interested in, but no pressure to know exactly what you want to do because you can always decide later.
What is something you wish you had known when you were a student?
I would say just don't be afraid to change direction. So when I decided that I will work in global health instead of being practicing physician, that was a big decision. And honestly, I thought in the beginning that it's almost some kind of weakness. I studied for so long to be a physician, and now I'm going to organize, medical services in camp, and medical degree wasn't even required. So, but to be more open-minded, and that's most important for young people or for not young people. I think to find what they really love to do, what drives them. After so many years, I'm so still dedicated, and I'm so glad I made this decision. And it's not a weakness, and it's not being, giving up. It's just finding what works for you. And yeah, and I wish I didn't spend all this time over analyzing my choice.
If you could change one thing about healthcare around the world, what would it be?
So that would be access to care, access to quality care for everyone, because it's heartbreaking sometimes when you see that people from poor communities can't afford care. And, you know, it's in this in 2026, when there's so many innovations in technology and everything, we still have millions of people who don't have access to care. So, yeah, if I could do that, I would provide care for everyone. And I think each country should strive for providing care for everyone and to have either insurance that is like majority countries actually have, but the countries with low income can't support much that they provide. So that's very different in every countries, but that's what I would do. Access to quality care for everyone.
What gives you hope for the future of global health?
So the hope it gives me, science. There are so many developments in science, and now with AI, there is promise, such a big promise. We'll see how we and what we end up with, but there is so much scientific discoveries in innovation, but this innovation, when so many people don't have access to basic care, I'm not even talking about some sophisticated care, it doesn't work. So for me, again, the access to care, science, collaboration, and innovation, it's not only technology, obviously, and new, gadgets. It's how we do things. And there's so much space in innovation, in delivering services for people in need. So yes, that gives me hope. and of course people. And I would say that young generation, I think it's have this. I'm not generalizing, but at least people who work for us after college or volunteered, there is so much. I think such a strong drive for like this fairness, equal access, etc. So in different countries. I just came back also from International AIDS Conference in Rio de Janeiro, and speaking and listening to different the people from all over the world, and it was really inspiring how young generation of professionals are so passionate about this equity and also the access to everything we can offer to everyone, not just selected and lucky ones who have means. So people should not get lower services if they based on income. I know it's idealistic, but maybe someday we'll be there.
What do you hope the next generation of healthcare leaders will accomplish?
Yeah, basically that the same what I just mentioned. So the access to care, and so it won't be people in the world who won't get the treatment just because they don't have insurance or something like that, or they get treatment and then will be forever in debt. So access to care, access to quality services, and strive for innovation in various aspects of it, with people in the center of everything we do, not income, but people.
Thank you so much for taking the time to join us today and sharing your experiences, insights, and advice with us. It was inspiring to learn more about your journey in medicine and international health, as well as the important work being done through the American International Health Alliance. Thank you so much.
Thank you, Ada. Thank you. Bye.
Thank you.